everyone, welcome back to Fact Fascial Assessment with Clarius Technology. I'm Dr. Roya Zarmezamin and today's episode is about the temple. Temple is one of the most underrated area in terms of aesthetic outcomes and one of the riskiest area as well, because this area that has a lot of vascularity and sometimes a variation in vessel supply, it's very important to know. That's why treating this area, most of the time it should be multi-layering, and based on the ultrasound assessment, we decide what to do, if we are going multi-layering or 1 or 2 layer or all 3 layers to treat. One of the most popular treatment is supraperiosteal or gunshot technique, which we are going one-on-one over from the orbital rim over the temporal crest to inject on the bone. But it's crucial to do the safe mapping with ultrasound to make sure there is no vessel in that area before place your product or damage the vessels or embolize the vessels, and the cause going to be ischemia or blindness. Let's review the anatomy of the temple. Temple starts from the temporal crest, which you can palpate, or even you can scan, which I'm showing in a bit, scan with the scanner with the ultrasound to make sure where the temporal crest is. That's the temporal crest. I'm marking down to orbital rim. And this is superior border. Inferior border is upper side of zygomatic arch. Anterior border is lateral part of the orbital rim. And then posterior is going beyond the hairline. Now, in terms of injection and assessment, one area which is the swift point, and that's the supraperiosteal injection or gunshot technique. It's 1 centimeter upward on top of the crest and 1 centimeter just vertical to the previous point, and this is the area we usually go and do the gunshot technique. With ultrasound, I'm showing you that we can scan this area, safe mapping this point, if there is no vessel on the periosteum that you can inject. If there is a vessel close, very close to this point, or just underneath, exactly in this point, underneath this point, then either you need to change the point, or for this case, which has a little bit short temple, you need to think about or double think and just choose another layer, which is interfascial or subcutaneous. Now I'm going to scan the temple and show you the layers and safe mapping for this area. I'm using Clarius L20 linear probe, and then choose the forehead temple preset. Okay? You see the temporal crest, frontalis muscle, all the temporal ligamentous adhesion, and then you see the bone in temporal fossa, and then you see temporalis muscle on top. We're going to see the 2 lamina of deep temporal fascia and the fat pad in between. Above this is 2 lamina of superficial temporal fascia, and between these 2 fascia is interfascial plane. Now, we see some round shape and echoic structure, which is the vessels. Superficial vessels. I'm starting again from the crest, just scanning downward to check some of the vessels, but these vessels is not in my way of injection. Even if I'm seeing it, I know the depth and everything. If I'm going to use the cannula interfascial or superficial, I'll be careful to not hitting any vein or arteries. Now I'm going to map the injection point that we talked about. Place the midline marker of my probe or my footprint exactly on top of the injection point which I marked. And then turn on the midline marker here. Make sure I'm in the area and turn on the color or power and try to just a little bit movement, which I'm showing now, to see if there is any vessel or any flow that I can see on top, which then you can realize if you don't see any flow, you can inject on the bone. Then now I'm going to inject ultrasound guided in interfascial plane and or maybe subcutaneous if they need it. You have to make sure that the area is clean. I disinfect the area. If I'm going to inject with a needle and needle might touch the footprint of the scanner, I cover the scanner with a sterile cover or use the sterile gel. But if I'm using the long cannula and make sure there is a little bit distance between the injection point and the cannula and just the scanner, I don't need anything, like covering my scanner. Here, my entry point would be here on top of the zygoma. Just a little pinch. If you approach from the zygoma, it's very hard to go blind with naked eye without ultrasound, because if you go on the bone, on the periosteum of the zygomatic arch and then go, just introduce your cannula toward the temple, you are definitely going to do the fat pad between two lamina of dip, not in the interfascial plane, because this fat pad is just running downward to the zygomatic area. Introducing my cannula a little bit deep, going upward, and check with my scanner to make sure that I'm in the right plane. My scanner is here, and I'm checking my needle, which is here. You see my needle as a very shiny, bright, white line. This is my needle, and I'm going to make sure that my needle is in the interfascial plane. Here, let's just turn on the needle enhancement. To see, yep, I'm in interfascial plane. And going to inject. And you see this reverberation in the bottom of the image is the reverberation for needle. And if you see the dark area is the HA filler that I'm injecting in interfascial plane. Okay, this is how you do the ultrasound guided interfascial injection of dermal filler into the temple. Now, if I'm going to show you subcutaneous one before I finish the treatment, I'm just going to stop the scanning. Usually for subcutaneous area, we're not using the guide of the sono. For expert they don't need to use it. Interfascial is very hard to get into, that's why we're using it. But I'm just going to show you the different depth of my cannula with ultrasound. As you see, my needle here, very superficial subcutaneous tissue as a white line, hyperechoic line. Here you see my needle, and I'm just going to inject a little bit to show you a little bit of the injection. That's my needle and injection, okay? This is how you treat the temple. Safe mapping for supraperiosteal, ultrasound guided injection for interfascial, or maybe used for subcutaneous injection. Thank you for joining us for this amazing episode, interesting episode, because this is very risky area, and stay tuned for the next one.